Very good afternoon and good evening, one and all. Today is our 295th uninterrupted Zoom webinar. So we can start with this silent prayer, 1 minute silent prayer. Thank you. Yes. So, as I said earlier, today is our 295th uninterrupted Zoom session. For the last 45 days, we are discussing on the same subject. Today, we have three panelists. Dr. Marina Afanasifa from Latvia, Dr. Maria de Salcedo from Bolivia, and Dr. Geeta Jose from India. So our subject is same. What needs to be done to make homeopathy the #1 medicine in the world? So each panelist have 10 minutes each. And after that, we are going for the discussion. So on behalf of International Forum for Promoting Homeopathy, I would like to welcome the first panelist, Dr. Marina Afanasiva from Latvia. She is completed a medical doctor in 1983. Since 1991 till present, private medical practice in homeopathy. 1998 to 2010, Liga Medicorum Homeopathica Internationalis, Latvian Vice President. LMHA, Latvian Vice President, founder of the Baltic Homeopathic Union 2010, since 2010 till present. The Baltic Homeopathic Union President. In 2019 to 2020, prepared the program Residency in Medical Specialty. Homeopath for Riga Strandin's Medical University, head of the program. President of the Congress.
Feroz, I think she is not 18. We can start with the Dr. Maria Salcedo from Bolivia. I think the Latvian doctor is not 18 in my observation.
All right. The third panelist is there, right?
Yeah. Dr. Geeta Jose is there, yes.
Yes. You please contact the Latvian doctor, please.
Yes.
So we can start with the Bolivian, our familiar Dr. Maria Salcedo. She is one of the back pillar from Bolivia. Maria Salcedo is a medical doctor, a homeopathic doctor, Argentina's Medical Homeopathic Association, MG Science Public Health, San Antonio University, La Paz, Bolivia, independent researcher in complementary and integrative medicine, Loyola University of Bolivia, teacher of postgrado. On behalf of Ifph, I would like to welcome Maria Salcedo once again. Please, ma'am, the next 10 minutes you can discuss about the same subject. Thank you.
Good morning, good evening, good night to everybody. Thanks for the invitation. I want to thank in a special way to Dr. Shaji Kudai for the invitation once again as a panelist of the forum. And thank you all for your attention. And I hope I can contribute some good ideas to make homeopathy the #1 medicine. I believe that each one speaks according to their own professional experience and according to their experience of life and development of each region. In this sense, I believe that it's important to exchange these experiences in order to promote homeopathy at all levels. The term medicine #1, I think, is a very big phrase, since in my life and in the life of my family, homeopathy is already the #1. And I think that is very important to replicate these experiences in the life of many people. In this sense, I will focus on my line of thought so that homeopathy can be number one on the life of many more people. I think the most important event in all aspects of the life is education. If we have a good information, a good education, we can have a very good decisions to our life. When we have a good education and information, we can make good decisions and maybe we can be successful in life. In order to promote homeopathy as a number one medicine, I believe that there are different scenarios that will develop them from the most important to the least important. I will think in 4 pillars important to develop homeopathy like a medicine number one. The first one, it will be the interventions for the general public. The second one is, will be actions at the level of homeopathic doctors. The third one will be actions at the institutional level in health. And the fourth will be the politicians. I will start with the general public. I think we will need different interventions. And I think that in this level of intervention is the most important because the pandemic teaches us that health depends on each one. And now, more than ever, people have more doubts and they began a process of searching of other therapeutic ways to regain health. I think it's important to clarify in the general populations different aspects of our sciences, such what is homeopathy, conceptualized as an individual sciences for each patient, the breadth and dynamism of the health disease process. Another point very important is to conceptualize what is not homeopathy, reporting how homeopathy does not answer to the typical questions, what I take for X disease, or what anti-allergic in homeopathy exists for my allergy or rhinitis. I think it's very important to report the effectiveness of homeopathy based on the scientific studies demonstrating this effectiveness. It's important to inform that homeopathy is not only for chronic disease, that is very effective for acute disease too. So we could reach many more people. It's very important to report that the time of action of homeopathy medicine is fast. In the words of one of the classical authors, a well-administered homeopathy is as fast as morphine. It's important to clarify now with people that homeopathy is not part of a religion or part of the New Age movement. I think it will be very important to organize free conferences dealing with the topics described above, open to the general public in the dominant language of each region. These conferences will be made up of a local homeopath with the support during the conference of other colleagues from other countries, telling their experiences and showing and for spread the advance of homeopathy in other countries. For example, in Bolivia, in my country, there are a lot of confusion between homeopathy and natural medicine and phytotherapy. Is the same for our people to take an infusion than to take an homeopathy remedy. I think it's very important to clarify that point. The second part will be actions at the level of homeopathic doctors. I think it's very important that we should all know and strain the Hahnemannian knowledge. That is what identified us as homeopaths. I believe that it's very important to standardize the type of information that is given to the patient and to the general public. This action will give a more serious support to homeopathy since the explanation for their use will be exactly the same in all our countries. For example, if I give some information in Bolivia and the people look up in our forum, we'll find the same information in other countries. So I think This is a very serious support for homeopathy and their spread. I think it's very important to create a network of cooperation between homeopaths for continuous improvement and solution of doubts. In this sense, I think the forum plays an invaluable function, which we should spread more between our colleagues. Older and experiences of homeopaths could leave this valuable legacy in hands of younger homeopaths who lack this expertise. Another point very important for us, I think, in South America is very important is the cost for studying homeopathy. The cost of training in homeopathy makes it very difficult to train in this area, since in many cases we have to leave our countries, giving up our jobs, and we have 2 or 3 years out of our countries, and then when we arrive, nobody knows homeopathy, nobody knows about homeopathy, so it's very difficult to have a job, a serious job with this. I think it's very important to have trainings, meetings, professional, to improve and generate ties of friendship and collaborations. I think the forum is already doing it, and I congratulate, and I want to give my congratulations to this job. I think that we maybe can have different actions at forum level. For example, maintaining the activities that have been done up to now and continue promoting that bond of friendship between doctors from all over the world. So in this point, I really would like to give the thanks to Dr. Shaji, because for him, I know a lot of homeopathists in different countries, and they are very friendly with me. So thank you very much. It's very nice to be part of this forum. I think that each representative or person in charge of their country should organize conferences for the dissemination and promotion of homeopathy for their own populations, with the support of the forum, so that homeopathy is better known and accepted. I think that especially in South America or Latin America, is very well seen when you have a colleague from another country that is supporting you. It has a very serious basis. So I think that homeopathy will be better known and accepted too. And I think it's very important to disseminate the scientific basis of homeopathic medicine. I was in some last forum that I was hearing about nanoparticles and about a lot of very interesting research that is very important to spread and promote this research, not the knowledge, also the way to do that. And for the third one, maybe will be actions at the institutional level in health. We know all that it's impossible to include homeopathy within public health systems due to many factors, one of which is the time spent with the patients. In Bolivia, as an average, the average of attention in patients is 15 minutes per patient. So as homeopaths, we know that this time is impossible to generate in a deep consultation with the patient, and even less with the family. But maybe if we try to make an integrative health programs will be generated in which to work with patients and have some interactions with allopathic doctors, has markets in different illness, for example, pain, cancer patients, victims of violence, somatization or disorders, maybe will be a great effort for the patient and his health. Maybe we can try this kind of programs in the framework of integrative medicines or the World Health Organizations, and try to make these attentions in different hospitals, institutions of our countries. We have here in the references a hospital in Bolivia, an integrative medicine program who integrates different alternative medicines in neurology, and we have a very good result. By the pandemic time, it's difficult to go to the hospital at now, but maybe we can try to develop this kind of programs with integrative medicines, including homeopathy, and just try as a study, then we can have a lot of statistics and results, and this will be very important for the organizations at the hospital and health public system. So I think I can give these ideas. I hope that some of these ideas will help the forum, will help the homeopathy, because I love homeopathy since the time I know homeopathy, and thanks you all for your attentions, and Dr. Shaji in a special way. Thank you for the invitation.
Thank you, Doctor. We know you much love in homeopathy and your dedication and involvement. We really appreciate your dedication and involvement. Thank you, Doctor.
Thank you very much. I appreciate all your thank you.
Thank you. Thank you, Doctor. So I'm moving to the next panelist from India, Dr. Geeta Jose. Dr. Geeta Jose has completed his BHMS and MD in homeopathy and MD in homeophilosophy, CGO, BA and English literature. Great. Professor and hospital medical superintendent, Government Homeopathic Medical College, Calicut, Kerala, that's in India. Heads from Kollam district of Kerala and now settled in Calicut. Chief coordinator of an infertility project management and research center in homeopathy, IMRCH, at Government Homeopathic Medical College, Calicut, it's in Kerala. Has been faculty to many seminars in gynecology and especially infertility in almost all the colleges of Kerala and a few colleges of Karnataka and Tamil Nadu, the other districts or other states of in India, Karnataka and Tamil Nadu. Has been faculty to seminars organized by medical associations, Government of Kerala and Karnataka related to mother and child care program. Had been Board of Studies member of KUHS, Kerala and Calicut universities. Ma'am, we would like to hear more from the infertility treatment, but I think the day after tomorrow, the special...
Tomorrow we will have a special session from Dr. Geeta Jose about homeopathic management of gynecological cases. She is an expert in that area, and I invite now all the listeners and participants today to attend tomorrow for special session by Dr. Geeta Jose explaining, presenting her good experiences with the homeopathic medicine in gynecological cases. It will be a wonderful opportunity for all the participants. So I invite all of you for tomorrow's session also. Dr. Geeta Jose will be presenting a special session for us. Thank you. Over to you.
Today, ma'am, you can discuss about our today's topic. What needs to be done to make homeopathy the #1 medicine in the world, based out on your experience, your wonderful experience. Thank you, ma'am.
Good evening to one and all. See, actually, it seems to be my dream to make homeopathy the first medicine in the world. Can you hear?
Yeah. Please proceed. Yes.
Yeah, it seems it's actually my dream. And homeopathy, see, I'm very, very sure that it can work wonders. That is, but the one drawback we have experienced is that, see, all of us, we concentrate on the chronic cases, because most of the chronic cases come to us. And the acute management. See, acute management actually, such cases, the emergency cases, doesn't usually come to the homeopaths. They actually go to the allopathic side. So for us to make homeopathy the first medicine means, basically we have to learn the management of emergency cases. The emergency management should come in full-fledged in homeopathy. So for that, what we have to do is that, see, as homeopaths, we all know that what Hahnemann has said is about the single remedy. We have proved a remedy as a single remedy, not as a multiple remedy. And we have all the head-to-foot symptoms in our remedy. Regarding each remedy, we have all the proven symptoms. So we are sure that if such symptoms are there, if you give treatment for a case, that has those symptoms will be able to cure that condition. We are all sure about the homeopathic principles. So as such, we all know all those things. But actually, I think most of us have deviated from such rules. That is a single remedy, minimum dose. So that is the first and foremost thing we have to understand. When we come to the emergency management, we have sure short remedies for such emergency cases. But if we go behind the multiple drugging, multiple doses and all, we won't actually reach anywhere in case of emergency management. Whereas in emergency management, we need a single remedy in a single dose which will give a sudden effect. So that is actually present in homeopathy, which we don't actually experience in our daily life. So we have to bring out that such an experience we have to bring out. That is the management of emergency cases. So for that, we have to work much for that. The first and foremost thing is each homeopath has ought to have a very deep knowledge of our metronomy. That is, we have to go in depth into the metronomy. Then the homeopathic philosophy. That is, we ought to have an in-depth knowledge about the materia medica, the homeopathic philosophy, including the organon of medicine. That means we should practice according to the homeopathic principles. If we practice according to the homeopathic principles, it's definite that we can reach wherever we want. That is, we can aim very high and we can reach that point. So that is, see, it's from my experience I'm saying. That is, I have more than 35 years of experience in homeopathy. And from that, I conclude that we can reach anywhere, wherever you want. Because when you treat with homeopathy, you can see that. See, there's a usual saying that homeopathy will work very slowly. That is, it's not at all a fast-acting system of medicine. That is, it works very slowly. But from my experience, I'm very sure that it works all of a sudden. That is, even for an acute emergency, that is when a patient tries for breath. At that time also, if you just give a homeopathic remedy, the right remedy in the minimum dose, definitely you'll be getting fantastic results. That is, the patient will not need any intensive care, no ventilation, nothing. So such is the homeopathic action of homeopathic medicines. So for that, we ought to know basically the homeopathic materia medica very thoroughly. We ought to have a thorough knowledge. Then we ought to have the I can say the guts to treat emergency cases. Actually, we just people don't come to us with such emergency cases and all. They just go off to the allopathic hospital. Even though for other conditions they come for homeopathy, when an acute condition occurs, they just go for the allopathic side. But that should be turned over. That is, we should manage acute emergency cases. For that, what we ought to know is that homeopaths should be trained in emergency management. We ought to get better training in emergency management. I think for that we can utilize the skill of certain doctors. I think there are a number of doctors who have both the degrees, that is homeopathy in homeopathic degree as well as the allopathy. I think there are postgraduates also. I heard of some people, they are postgraduates in allopathic medicine and they have come for homeopathy. So if you utilize the skills of those persons who know both the medicines, actually the homeopaths can be trained in emergency management. So I've heard some of their talks and all from that. I know there is those who have faith in homeopathy, not all the people who have both the degrees, but those who have acquired both the degrees and they are in favor of homeopathy. Even though they have both allopathy and homeopathy, they favor homeopathy. Such people, that is, who have an intense faith in homeopathy. Such people, I think it will be better if we get a training from such people who have faith in homeopathy. So if you get such trainings, you will be more skilled in emergency management. So in our hospitals and all, we can start emergency management cases. See, in our hospital in Calicut, I'm just striving to start an emergency management. Since a few years, I'm behind it to start an emergency management, but due to some technical reasons and all, I'm not able to start it. So anyway, I'm still on the way. We want to start an emergency management OPD. So if you start an emergency management OPD, see, we have to first of all prepare a protocol. That is at which stage we should send or refer a patient. That is in all emergency cases. That is up till which stage we can manage it by ourselves. So we should prepare a protocol and we should manage emergency cases. And if we manage emergency cases, see, in Calicut, I think a number of people, they prefer homeopathy. A number of people in Calicut prefer homeopathy. So here we start. We'll gather their opinions. We can gather their positive opinions and we can go further. So we can start. There is at each level you have, not only in Calicut, at each place we can start. We can start the emergency management, and we have to know how to manage the critical conditions. The emergency cases of a critical nature, we should know the management, and for that we can utilize. That is now in our hospitals in Kerala, we are recruiting the allopathic nurses. See, those nurses, they know the accessory measures. If such nurses are there, we can move forward with that. If we know the medicines to manage such conditions, and if the accessory measures are provided by those nurses, we can actually make it a big success, the emergency management. And initially, we have to record each and every case. That is, we ought to have proof. That is, whenever we say that we have treated such and such a case, see, we get a number of difference of opinions. So they say, there is the others, they they attack us and say we don't have, we are simply bluffing them. So actually we should keep a proof of it. We should have a proof. We should record the cases. We could record the cases with all proof, and we should keep it, retain those recordings, so that we can present it before anybody who have any difference of opinion about our success. So like that, we have to, that is basically we have to start. We start that emergency management. Say, we know we treat chronic cases in plenty. A number of cases come, but the existence of a system of medicine, that is as a first medicine, means if we know how to manage the emergency cases, we will be considered as an that is not as an alternative medicine, as the first medicine we will be considered. So we have to try our level best to come forward. That is, each homeopath has to try this. That is, we shouldn't deviate from the principles of homeopathy. We follow the principles of homeopathy and come forward. See, I have plenty of experiences in that. That is, for example, if there's an accident has occurred, see, immediately most of the deaths are due to loss of blood. See, that we can manage very easily. If an accident has occurred, just by giving arnica 30, you can manage the case. See, to control the bleeding, if a wound is bleeding that much, you can give arnica, or else hamamelis is another medicine which controls the bleeding immediately. You can give put a single dose of medicine on the tongue, and you can soak arnica tincture or 30 in a piece of cotton, place it over the wound. It will immediately stop. And if it's a road accident, now you don't know from where all the bleeding occurs. You can just give it internally as well as externally. The same medicine can be kept, and within seconds you can watch it. That is, the bleeding will stop. So we have such wonderful medicines, but we are not at all aware about it. So that's our fault. We are not aware about the magics of homeopathy. So that we have to come forward to learn all these things. And for cardiac management, we have plenty of medicines for acute cardiac management. Say, from aconite, spigelia, a number of medicines are there which we can give. Digitalis, a number of medicines. So, and honors like that, plenty of medicines are there which we can say. The bleeding conditions, not only arnica. Arnica is the first medicine when you have a bleeding from any part you can give. There is following an accident, something like that, any blood vessel collapse, anything. There is a rupture of a blood vessel, anything, if you have, you can give arnica. Arnica is the first remedy. See, for stroke, it's a very good remedy. And I need to say that 4 years back, I had a stroke. I had fell in the bathroom, but of course, I was not unconscious while falling. I just prayed, and I somehow or the other, I went through without falling. I got a catch somewhere in the bathroom, and I escaped. I didn't fall, but actually my whole left side was paralyzed, and I couldn't move. Then I somehow or the other opened the door, and I took arnica. Arnica 200 was there. I just took one dose. I just went and slept. Next morning when I woke up, I was having a fear whether I could move my left side. After some time, when I tried to move, I could move the parts, and I just got up from bed and went. So that is the magic of homeopathy. And where I just went out to take a CT only on the 10th day. On the 10th day, when the doctors, when they took the CT, I didn't take any allopathic medicines on the 10th day. I just directly went to take the CT. And they couldn't believe. They said, it's a 6 months case, no. They said 6 months might have elapsed since you had the stroke. I told them, no, only 10 days back I had it. So they couldn't believe. They said the findings there shows that it is about 6 months period. It might have occurred 6 months back. So actually, the hemorrhage was there, but they couldn't identify only the fluid part was there. The cells and all were absorbed. So they said that only after 6 months you get such a. So that is the magic of homeopathy. And I didn't get paralyzed. Only thing I had a numbness of the left side. But all the changes that occurred, the deviation of the mouth, everything disappeared within a few days. Just within 4 or 5 days, everything had disappeared. And I regained the strength. And so now that's why I'm able to present before everybody. So that is the magic of homeopathy. So not only that, I have many, many personal experiences as such. That is for emergency management, for burns. You can see for burns and all, why should we kill the people? See, people go to the hospital, they get infected, secondly infected, and with that they die. See, if the burn is of a 3rd degree or 4th degree, definitely the patient will succumb to death. So why should we leave them for that? Just give the homeopathic medicines. You can use the homeopathic lotions, that is calendula lotion or cantharis lotion. Anything can be used with internally. You can give cantharis. Definitely the patient will get cured without any complications. And if we just try to manage these things, that is the emergency cases. And if we know the accessory managements also along with this, that is along with the medicinal management, if we are aware about the accessory management, or if we are able to recruit somebody who will take care of that accessory management, see, definitely we can come out with a perfect management of emergency cases. And if we manage the emergency cases, definitely people will come to us for emergency management. With that, we will come out of the list of that alternate medicine and come forward as the first medicine. So I think that is my imagination, how we can become the first medicine. So we should try the acute management, acute cases management. So if we go on like that, say in the recent pandemic, we were put aside, homeopathy was put aside by everybody. So if we know the emergency management, the accessory measures and all for the emergency management, definitely we can get through as the first medicine. That is, say, actually, when you compare the two medicines, see, in my experience, I have experienced that for healing a wound itself, see, if it takes about 5 days in the case of allopathic medicines, within 3 days, we can cure it with medicines. And also you can suture the wounds. There's no need of any TT or anything. You can just suture the medicines and give homeopathic medicines. With the homeopathic medicines, we can suture the wounds. We can just, that is within few days itself, without any infection, any secondary infection, nothing. You get a perfect cure. A perfect means the first line cure you get. So like that, if you go with homeopathy, for almost all the cases we have management. I think not almost all the cases, for all the cases we have management. Only thing we ought to know the medicine for it. For that, our materia medica knowledge should be increased. We should increase our materia medica knowledge, and we should follow the principles of homeopathy. And with the help of our fellow people, we can come forward. We can emerge as the first medicine.
Thank you.
So with that, I thank you for giving me such an opportunity in Ifph. I thank everybody for hearing me patiently. Thank you.
Thank you, Doctor. We got your confidence because from the first sentence onwards, we get your confidence. And I just want to know, please be with us, ma'am, for the next 30 minutes. And especially tomorrow, we are waiting for your tomorrow's session. And ma'am, you're completed in MD in Materia Medica and MD in Homeopathy also, right?
The organon and philosophy. So that year we had it as homeopathic philosophy.
Okay.
From Kukas, Kerala University of Health Science.
So that will get more,
It is organon. Yeah.
that you'll get more confidence. Am I right?
Yeah, I'm much confident in homeopathy.
Great, great.
So that's why it's not any bluffing. And I'm not bluffing or anything. It's actually my knowledge in homeopathy. That is, I know I'm that much confident in homeopathy.
Good,
The
great.
teacher is sitting there.
Yeah, I know my sir said so and all that. And my classmate, Dr. Joseph, said he's there.
Yes,
I've
yes.
seen said so. See, from them, from our gurus, we got all this knowledge. It's not from our own. See, I thank Dr. Ismail Said and all the other teachers who are present. I
God
haven't
bless you.
seen
God
anybody
bless
else.
Thank you, thank you.
Thank you, sir.
Always proud of you.
And
Because after my suggestion, he took gynecology and he's
Okay.
drive so much with the gynecology problems.
Yes,
So I'm
sir.
very proud about you.
Yes,
Keep
sir.
it up. God bless you.
Thank you, sir.
great. Our first guest from Latvia, she came, right, Dr. Shaji?
Yeah, yeah, she is available.
Dr. Marina Afnasiva, she came. So
Okay, I'm here.
yeah, ma'am,
Yeah.
can you hear me?
Yes, Dr. Afanasyev is here.
Okay, okay. So I'm coming to you, ma'am. Before that, no. So I can see a lot of people from different parts of countries. So can you please message, no? We are how many people from Pakistan, how many persons from Germany, how many persons from Turkey? You can send. You can please chat in your chat box, and we will get the knowledge. How many people from different parts of the country in the world? So we'll get more confidence for that. And today is our 295th day. We are actually planning to celebrate the 300 days with 24 hours sumathon. We are actually planning, and so we want the participation from different parts of the world. Then only the time zone for the 24 hours we should complete. Our plan is within 1 year, within 365 days. Once we completed another 65 days, 65 to 70 days, our planning is 24 hours uninterrupted Zoom channel. That's our future plan. So that can change the world. As Dr. Gita said, as Dr. Salcedo said, that can change the world. That's a dream of IFPH. So please message us how many countries are participating. Some of the people from Nepal, some of the people from Malaysia, and some persons from Germany and all. Please message us in our chat box. Anyway, I'm moving to the first person. Dr. Marina Afnasieva from Latvia. She completed her medical doctor's diploma in 1983. And since 1991 to till present, private medical practice in homeopathy. So you completed your medical doctor in MBBS, right, ma'am?
Yes. I'm medical doctor, finished medical university.
Oh, great. So
And then I Academy of Classical Homeopathy in Greece. And I studied homeopathy everywhere in the world, in India also.
Oh, great, great. So you completed your MBBS. After that, you come into the classical homeopathy. Great.
Okay.
And 1998 to 2010, you're the part of LMHI, Latvia Vice President, right? You're the Vice President of, Vice President of LMHI Latvian and founder of the Baltic Homeopathic Union 2010. Since 2010 till present, okay. Homeopathic Union President, Baltic Homeopathic Union President, 2019 to 2020, prepared the program Residency in Medicine Specialty Homeopath for Riga Students Medical University, head of the program. Great man. President of the Congress, the World in Homeopathic Perspective, to be held for April 7 to 2022. Oh, okay. It's a coming event, right?
Okay. Next year, I invite all of you to participate.
All right, all right. Okay, that's in Latvia? Or?
Yes, it's in Riga, in Latvia, capital of Riga. It's already second World Congress. First one was in 2011. It was first European Congress of Homeopathy. A lot of doctors from India were there.
There is an event in coming September in
coming. Yes, no. Now coming event, it will be in the day of homeopathy, birthday of Hanuman, from 7th till 10th of April, 2022, next year. I hope this Congress can be in person, not online. We would
So
like.
how many participants will be expecting by the April 17th?
In the former, on the past Congress, we had 400 people from 40 countries, but for this Congress, I do not know how much we can expect. We expected a lot before COVID lockdown, but now we will see what the situation will come.
So most of the doctors are completed in same like USA, like after completing the MBBS degree, no?
Oh yes,
Maybe
mainly yes. Okay, and about the previous sentence you said, during this COVID lockdown, we succeeded to make homeopathic programs in medical university, the first official program in medical university. It's in Europe for sure the first. In India, I'm not sure, because you have a lot of colleges and schools where you can teach homeopathy. Medical doctors, not medical doctors, just people who want to study homeopathy. But this is the first course for medical doctors. It's a 2-year course, and we started since 1st October 2020. And now first course is almost finished, and it's very, very productive course, because the teaching is on the highest standard. I think Indian doctors has also very high educational standards, highest in the world, because you're the first, you're pioneers, and the most successful country in homeopathy. So meantime, I'm very glad to welcome the participants of International Forum for Promoting Homeopathy. Thank you for inviting me. Providing and promoting homeopathy is what I'm doing all my life on different levels, from homeopathic cure till educational work and politics. And as far as I understood, I invited to answer the question, what needs to be done to make homeopathy #1? Is it right?
Please,
#1 medicine in the world, yes. And I may surely said that homeopathy has already own place in modern medicine. This is medicine for the elite, not in India, but in Europe, in other countries for sure. For those who are aware of possibilities of homeopathy and want to be truly healthy. Unfortunately, the spiritual development of modern society leaves much to be desired. The standard of living and the political environment determine the awareness of the population, in homeopathy particularly. And the level of education of people and the state of their own health determine a reaction to this information. There are some constitutions, as you know, which are so unsettling that no homeopath will convince them, for example, not to make vaccine, not to vaccinate against a declared pandemic infection. So Arsenicum album people will go all together for this. For this, we need to cure them. In most cases, very much succumb to propaganda of the mass media, which follows the instruction of those who finance them. An illustration of this is the event of the last year. The purpose of this event is the opposite to direction to the spiritual flourishing of society, of any society. The purpose of this event is to depersonalize and to separate people. But enlightened people will not allow these plans to be realized. And this forum, today's forum, is evidence for this. Will homeopathy ever be the first choice medicine? It is already for those who are aware of it, and especially for those who have already tried its healing effect on themselves. I'm sure that your patients whom you cured never go to allopathic medicine. Only in case of traumatology or acute surgery, it is absolutely normal course. So maybe not necessary to desire should homeopathic medicine was #1 in the world, because surgery, traumatology, gynecology, obstetrics is the branches of medicine which must exist, but homeopathy must become the medicine of first choice. So people must choose themselves where to go. And as long as there is lobbying for allopathic pharmaceutic production, this will not happen, that homeopathy will be permitted to become number first. We must ask ourselves the question, who do we want to convince that homeopathy works? Towards it, that is the most effective and the safest medicine. And we will understand that we have no one to convince, because it is known thing. Even the powerful, the richest people know this. For example, John Davidson Rockefeller Sr., who lived from 1839 till 1937, he wrote, "I am a friend of homeopathy. I wish that homeopathy followers are treated fairly, politely, and liberally by all the institutions we promote." But as you know, namely Rockefeller families created new systems in America when they closed all the homeopathic colleges, and they said that now it must rule so-called scientific medicine in the world. So they created special university, and they created chemical pharmaceutical industry. So that homeopathy works and homeopathy is very effective knows also English royal family, as you know. And Queen Elizabeth and her children, grandchildren, they all have own homeopathic physicians. And the services of homeopaths are used by political elites of different countries. They only hide it from the public. We got information this year, during this year, that people from elite, so-called elite, who were ill, who became ill with COVID or other disease, they were cured by homeopathic doctors. And this information was be published, but not on the wide public, unfortunately. And in order to change the situation, at least a little, a greater awareness of population is needed. But not from the homeopaths, not from homeopathic doctors themselves, but from patients who have been cured homeopathically. If the critical mass of the people who have become healthy, thanks to homeopathy, exceeds, then the rest will also begin to sink. It's just necessary to sink. But you know, as homeopathic physicians, that healthy thoughts appear only in healthy minds of healthy people. So in others, delusions prevail. After 30 years of homeopathic practice, I have come to the conclusion that the future of homeopathy is in the hands of homeopathic doctors themselves and our patients. All that is required of us is to do our job well. We need not permit ourselves to make mistakes, or of course we make mistakes, but at least it must be only minimum number of them. And for this, we need to have excellent, full-fledged homeopathic education and give this education to future homeopathic doctors. Because on our teachers depend how our doctors will practice homeopathy. Our greatest teacher, Samuel Hahnemann, and those who follow him, they can educate. What I know from different countries, because I was in Liga Medicorum Homeopathica Internationalis, I know that many countries has no very high level or very deep level of homeopathy in their countries. And people who practice homeopathy so-so, they want to rule in homeopathic, among homeopathic doctors also there is people who like power, who like to rule, and unfortunately not all of them has very deep knowledge. So what I wish to ask you to spread information. Actually, you do all this. You know, the quality of homeopathic education must be very high, and maybe we need coordinate organization of our patients, homeopathic patients, because one day homeopathic patients may become maybe political force, because in situation when our politicians can occupy very high position even without corresponding education. For example, in Latvia now, Minister of Health is a musician, and he is ruling healthcare in the country. And I'm not sure that in other country situation it can be similar to, yes. And taking into account the position of healthcare authorities who keep resisting official inclusion of homeopathy into the existing national healthcare system and medical educational curricula, we do not expect the process of homeopathy implementation to follow an evolutionary course. So maybe we can present only two arguments relevant to politicians. First, the opinion held by the majority of the electorate. Here we have to rely on our patients. And second, action by another political force. Maybe homeopathy one day must become a political force. But I do not like this idea myself, because such a way we will go away from our medical professionalism, because everybody must do own work. But meantime, if there are people around homeopathy, close to homeopathy, influential people whom maybe homeopathic doctors cured and who are able to promote homeopathy on political level, it would be perfect. In India, you have already Ministry of all the alternative traditional Indian medicine and homeopathy among them. So I'm very proud of Indian doctors. It's country of dream where homeopathy on such high level. So we need to follow you, we need to borrow your experience, and we need to exchange as much as we can. So thank you very much for your attention. I am happy that my internet connection was working, because a few minutes before we start, it was not connection at all.
It's okay, ma'am. It's okay.
Yes.
Okay,
thank you so much.
As you said earlier, the sharing the knowledge and sharing our dream, that's very important. That's very important. See.
Yes, it's our dream. It's our dream. But you know, I live in homeopathic reality. What I prepared this curriculum for medical university for actually 15 years, and it was not success. But at least now, in the most extreme situation when everybody was against homeopathy, we succeeded, and we are example for everybody. So follow us too. Try to do in medical university homeopathic course, and my dream to make it from the first course of medical study. One day we will see.
Yeah. Today, thank you, ma'am. Thank you very much. Today we got a message. We have an international group for international leaders group and for IFPH, International Forum for Promoting Homeopathy. We have an international group. In that group, there is a message from Dr. Amir Malik. He said that it's a do or die situation. So we should act and we should talk more. So the same way, this is the time we should loud more. Our voice should be united, and we should talk more. So I'd like
to not to shriek, not to shriek. We need to be very intelligent, very diplomatic, and actually we need to, like silica, to keep inside some things, and when we got strength, go out, not earlier.
Yes, absolutely agree, ma'am. Absolutely agree. So it's a time for the discussion. So I would like to call one by one. Dr. Amir Malik, please come forward.
Hello, greetings to our honorable doctors, and a special and grand thanks to our IFPH creators. And today I'm really very happy because we have the Honorable Dr. Marina, and she is a MBBS doctor. I am very happy to see this. Honorable Madam, good morning, good afternoon. Grand greetings and warm regards. Honorable
Thank
Dr.
you so
Marina.
much. Thank
Yeah,
you so
God
much.
bless you. God bless you. This is, we proud of us for this, that you are a MBBS doctor and you are a then homeopathic doctor also. So we know what kind of the skills you have, no one have. I believe this because our father of homeopathic, Dr. Frederick Samuel Hahnemann, he was actually MBBS doctor, and nature's the destiny help him, and he get discover this grand treatment, which is the best, safest treatment for the humanity. From that to this time, it's a historical benefits for the humanity. Honorable Doctor, we want your street experience, your street skills, your grand beneficial formulations regarding where the lay homeopathic doctors stuck and failed and cannot approach the right medicine. Honorable Madam, if you are today, you are on our panel, it's our, we wish you good luck. That we wish also good luck to Ifph, that we get a golden benefit points from you. Kindly please have a light on the issues, the brain tumor, when the creatinine is very high, what the excess remedies you give regarding homeopathic doctor and with the knowledge and experience of MBBS doctor. You have two in one qualities. So I hope that the medicines you approached or you have the vision, another doctor who is not MBBS or just another qualifications, he can't approach that medicine. Please, 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 please give some a light, some information, some knowledge, share your knowledge, please, your formulations regarding the chronic ailments which you want to this time. Because all of we doctors want to take benefit from you. It's you pour this knowledge to us. It's a light to us.
Thank you, doctor. Thank you, doctor. Dr. Hubert, please come forward.
You all, thank you very much for inviting me. I want to ask Dr. Geeta Jose. Please let me see her face. I am very much delighted to hear you management of acute diseases. I am always trying to get knowledge for treating acute cases. But in some time, I feel some difficulty that is in fits condition and also in urethral renal colic. That time severe pain may be there. How you can manage it? Normally, I wanted just to know what are the medicines you are using for such cases.
Renal colic, we have plenty of medicines, no? And of that, see, for both sides, whether left or right side, we can give Berberis vulgaris. It's a very good medicine. I see if it's a severe pain, the patients come, just give 5 drops of the tincture. So always give the minimum quantity, 5 drops Berberis vulgaris tincture. Then after giving, that is just for immediate relief. After that, you have to give the potencies 30. And that also don't repeat the doses, just give single dose. And along with it, see how I practice is that I just ask the patient to avoid all medicinal substances. That is, don't take coffee, then all the medicated waters, medicated hair oil, everything. I just ask the patients to avoid all those things and just give a single dose of it.
And then
So that is one important medicine. Then you have sarsaparilla. Sarsaparilla, another very important medicine. So we have plenty of medicines like that.
Yeah, these medicines we are using.
Yeah.
But I want to ask you another one. Fits for handling fits in fits condition.
Is it febrile fits or?
Yeah.
So febrile fits.
Febrile fits and status epileptic, just such time, epilepsy that time.
Yeah, epilepsy. See, for febrile fits, it's usually seen in children. So if it's if the child is having that intermittent fever with when the fever rises, if there is fits, Sina is one of the very important remedy. Then another remedy is Sikuta for febrile fits. That is with intermittent fever. If it is a continuous fever, belladonna is another medicine. So you just give it in the lowest potencies. And also when you're treating acute conditions, it's better if you give it in the divided dose form. That is just a drop in half a glass of water and give every 1 hour 1 teaspoonful in divided dose form. That's always better in acute conditions. To manage acute conditions, always give it in the divided dose form.
That is in fever condition.
Yeah.
Otherwise, in fits condition.
Otherwise, it depends. That is,
Epilepsy, in epileptic attacks.
epileptic conditions, see, cicuta is one remedy, then cupromet, then another tincture is there, oinantha coqueta. That's another medicine which you can give for immediate relief. See, those remedies which you give in tincture form, you get only a sudden relief, following which you'll have to give the potency. Whichever be the potency, the indicated remedy which comes, you have to give. See, when I told about Berberis vulgaris also, that is just for to manage that acute, at that time you can manage it. Following that, you have to give the indicated remedy. Whichever be the indicated remedy, just give it.
Okay, thank you. Thank you, Maria. Then go to Marina, Dr. Marina, madam. We know that music, you already said that two political leaders having, they are very much like homeopathic medicine, and this is like music. Music also, there is no change of any material part. From singing on, only singing the sound, it is we know that we can cure. I am also a musician. I can say that music can create so many, so much changes in every, those who are hearing that music. We have so many ragas are in Indian music, but when we are using it, we can make it, music therapy can be done. But in such condition, only changing of some powers are changing from one person to other. This is like in homeopathy, we are giving some medicine also. There is a physical material changes is there. How you can correlate this music and homeopathic medicines? Can you say anything?
I work in, for example, my own experience that I work very deeply with psyche of the person, and each soul has own song, as you know, as each soul has own delusions, can be misled once in life or a few times in life, had a lot of stresses and so on. So when we discover the truth of the soul, when we discover hierarchy of topic for life value of this person, when he know chronology, how it's happening, we investigate life of our patients since the day of pregnancy of mother, and of course, as all of you, we investigate family history, first year of life of the child, and so on. So I feel very, very much satisfied by the results we have for especially last 10 years, because it's already like culmination. For me, homeopathy is real music. I practice music. I started practice music not very in early age. I even wrote music. So for me, homeopathy, it's reflection of it, because homeopathy gives harmony to each life. We need no any other medication. We need no other means to bring person to the balance, to normal way of life. The people who were cured homeopathically with chronic diseases, they take part in their treatment. They became aware. They became responsible for themselves. They create their own life, and in the process of homeopathic education, it would be very good if society would provide them with possibilities to change their life. It is what we are lacking of in modern societies, unfortunately. Our politicians do not care about people. Our politicians care only about their pockets, unfortunately. Not all, of course. I hope in India you have better situations than in Europe.
Oh, ma'am, everywhere is the same.
Thank you.
Yes,
thank
you
very
think
much,
so.
madam.
Anyway.
So I think we all together with you coming to harmony of life, harmony of societies, harmony of life as God created it. We restore this harmony which was sought by God for us.
Homeopathy,
Mhm.
apart from the science, homeopathy is something above. Am I right?
Yes.
Yeah.
Of course, it's above because when I ask, I ask my wise teachers, whom I have a lot in the world, I ask them where Hahnemann took the knowledge, which remedy to take for proving, which, and they said from above, from above, it was given him. He was great believer. He was cleverest, wisest person. He was very thorough in his investigation. He wanted to bring health to his own children. He started because of this, and then he spread.
Remember, that's IFPH is the International Forum for Promoting Homeopathy. Our dream is also we need to develop a lot of Samuel Hahnemanns. We need to develop. It's a time to develop each Samuel Hahnemann in each countries. That's what our dream. Anyway, it's a time to act.
But our decision is not always possible to bring in life. We must, but we do what we can do.
Yeah, sharing knowledge is very important, ma'am. It's practically.
Of course.
Yeah. So that's why Dr. Shaji, that's his dream. 24 hours uninterrupted Zoom channel from 365 days onwards with all support, with the support of all of us. It's practical. It's practical. It's 12 hours per day for each country. Only 12 countries need. Right now it's possible. So we can plan. We have to plan. So please be united. That's the main thing. Okay, I would like to call Dr. Sridhara Kurup. Sir, please come forward.
Please raise your hand, sir. Sridhara Kurup, sir, please raise your hand.
Okay. Okay.
Yeah.
Thank you very much. It was an excellent session. Dr. Marianne, Dr. Geeta, Dr. Mariana. So it was excellent session, but I like to ask one question to Dr. Geeta Jose because he's a head of the Department of Calicut. That is why I like to ask one question. Don't feel anything else that because I am asking because that you are dealing with the obstetric and gynecology. That is why.
Okay, sir, you can ask. Okay, sir.
What are the medicine? Which are the medicine? What you felt it is more indicated during delivery, before delivery, and after delivery?
So actually, we are not dealing with delivery cases here at present. That is, we deal with antenatal cases only up to delivery. And for delivery, we send the patients to other hospitals and they come back after delivery. But during, that is before, during, and after delivery, we prescribe medicines for them. That is for what all indication, what all conditions we need, we just give them. Say, for example, in the antenatal period, if the baby is not having a normal life, that is, if the position is abnormal, in such conditions, there is between the, the baby gets tight inside the uterine cavity by the 36th week of pregnancy. So if you want to change the position of the baby, suppose a breech is there or a transverse lie is there, whatever abnormal lies are there, if you want to change the position of the baby, so you can give them medicines, homeopathic medicines between the 34th and 36th week. Changing the lie and position of the baby, chlorophylum is the best indicated remedy. Just give the 30th potency.
Even Pulsatilla is good.
Pulsatilla is another medicine which you can give. Usually Pulsatilla is preferred towards labor. When the patient reaches labor, see, it's said to be a uterine tonic. Pulsatilla is said to be a uterine tonic. And for easy labor, you prefer Pulsatilla. And in the case of undilated cervix, that is, if the cervix, even after uterine contraction starts, the cervix doesn't dilate properly, so chlorophylum is another remedy. There also you need to give the 30th potency. Cervical, if there is cervical dystocia. Dystocia means improper dilatation. At that time, you can give chlorophylum. Then Calicarb is another medicine which you can prescribe at that time. The patient will be having severe backache, that is dystocia with backache, when chlorophylum is one remedy and Calicarb another. There also Pulsatilla is a common remedy. That is, without the patient going, before the patient goes into any of these complications, that is just to give an easy labor, to get an easy labor, you can prescribe Percet.
What about the Viprinum opulus, that it will dilate during the delivery? It is telling os will dilate. What
Yeah,
about
cocculus is another remedy, it can be given. That is there, the patient will be having, there is a symptoms of cocculus will be there. There will be nausea, vomiting and all will be predominating. The patient can't tolerate the smells and also that will be there. If such a
I am
symptom is there.
telling about Viprinum opulus, Viprinum B.
Viburnum, yeah. Yeah. Yeah, Viburnum opulus is a very good remedy. So it can be given for the expulsion of the products of conception. That is in case of abortion, in case of ectopic gestation and all. So if you want to expel the condition completely, that is in missed abortion. If you want to expel the condition, the products completely, you can do. Also in postpartum cases, when there is any retained products of conception after labor, Viburnum opulus can be given. That is, it's better in the 3x potency. If that's not available, you can give the 30.
Okay, thank you very much. Only a knowledge person we can ask such questions. That is why I asked. Don't feel bad.
Thank you, Dr.
Not necessary. It is for knowledge.
Yeah, that's why we are planned. Coming 300 days onwards, actually 3 hours in a day, 1 hour for only for Hindi and our Indian national language, and 1 hour for the English international language, and 1 hour for Malayalam. That's what our plan for the coming 300 days onwards. So we can ask a lot of questions to the knowledgeable doctors. That's
very good idea.
Yeah. Thank you, Doctor.
Excellent.
Yeah, and Dr. Manoj, please come forward. Yeah.
Thank you, Feroz. The 3 persons are Ariana Salcedo, Dr. Geeta Jose, and Dr. Ariana Afancia presented very nicely. I think what Dr. Geeta Madam says is an important thing. The taking of the acute cases is emergency management. And I think the accessory management, we don't bother much about the accessory management, because by using our homeopathic medicines, we can reduce the requirements of the accessory management, just as you told in your own case. You just take the medicine, the arnica, and waited. Nothing happened. Just like that, if you use proper medicine, homeopathic medicine, definitely you can reduce. Then another important suggestion is that by cooperating with those who have studied homeopathy and allopathy, we can make it more easy. That's a very good suggestion, madam. Then another one is Dr. Mariana Afancy said about the who is the first medicine for whom, who are aware of the homeopathy is the first medicine. It's a very good remark by her. It's a very good. And then awareness of the patients is an important thing. Very good, nice presentations and very good discussions going on. Yes, thank you for all your participation, and I request all of you to participate regularly in this program, especially those from the Kerala colleges. So only rarely it happens. I'm very happy to hear our Geeta Jose madam's voice in this platform. Thank you, madam. Thank you all.
Thank you.
Thank you, Dr. Manoj. And I would like to, Dr. Jose, you will be saying the vote of thanks today. So please be prepared and for the vote of thanks. I will come to you after the discussion with I'll give 1 minute to Dr. Logmani Gupta. She is also very active for coming days. Please come forward, Dr. Logmani Gupta.
Thank you, sir. Thank you. Welcome to all. And nice to hear 2 converted homeopathy doctors. Converted, I mean to say, who had done their allopathy courses and they are doing so good for homeopathy. It definitely motivates the homeopathic situation in our country, India. Sir, one thing I would like to know from respected Dr. Geeta, as COVID had been a big epidemic and giving complications also. Ma'am, what medicine you are using for post-COVID neural troubles like neuritis, irritation, numbness, feeling in extremities? Please guide Dr. Geeta ji. I would like to be benefited with your experience regarding post-COVID neuritis.
So is it to me, the question?
Question is to you, as you are delivering your speech.
Just please, could you repeat the symptoms once again?
Yeah. I'm asking about post-COVID neural troubles,
Okay. Okay.
like some tingling in the extremities,
Yeah.
some excess pain and pinching feeling
Mm.
in legs. So what you are using for these troubles?
See, is the pain, tingling, and all very severe, intense?
In few cases, as it was said earlier, that loss of taste and loss of smell, these two things
Okay.
are very much related with COVID. But
Okay.
apart from it, patients are coming with some tingling sensation in extremities, with some radiating pains after COVID. So,
Okay.
what medicine, if you had used in your experience or can be used for the benefit of patients, please guide.
Okay. Okay. So, formic acid is one medicine. Then you
Yeah.
have lacanine. Lacanine is another medicine which you can give. Then, if the depending on the time of aggravation, if it's getting aggravated at night, syphilinum is one medicine. Syphilinum can be given. Then, yeah, you have to look into the whether the patient is a hot patient, chilly patient, the time of aggravation modalities and all, time modality, all those you have to see.
Ma'am, these are the main phenomenon of homeopathy.
Yeah.
To take location, sensation,
Yeah,
modality.
depending on that, you have to select the remedies. Depending on this, you have to. So these remedies come. Then tuberculum is another remedy.
Okay.
Yes, yes.
Thank you.
Thank you. Thank you. Thank you, sir.
Thank you, Dr. Lokmani Gupta. So I am going to once again our honorable guest. So I would like to start from Maria Salcedo. So, ma'am, you can conclude your today's session. Your concluded point. You can start with that. Dr. Maria Salcedo.
Yeah, here I am. So
Yeah.
thank you very much for your assistance, for paying attention, for all your information. It's very nice to share with you all. Congratulations to all the forum because it's a very interesting job in all the world. I'm really glad to be a member of this forum. So thank you all, and God bless you all too.
Thank you, Doctor. Thank you. Thanks for your wonderful inspiration and your appreciation from your side. Thank you, Doctor. So I'm moving to Dr. Marina once again. Ma'am, for the next 1 minute, you please conclude your today's sessions. Dr. Marina.
I will hope that internet connection will permit me.
Yeah, it's okay, ma'am. Yeah, ma'am. Can you hear you? Can you hear me? Yeah.
What would you like to hear now about my experience with what?
It's what? Yeah.
Conclusion.
Ma'am, I'm asking about today's conclusion. Today's conclusion about your point.
Conclusion of today. So, first of all, I'm happy that you are active in connecting homeopathic physicians all over the world. It's very good because we need to have our views, how to follow, how to proceed with organization of our intentions, of our actions, except of normal, everyday practical work with patients. So I think we have already two very strong organizations in the world. It's Liga Medicorum Homeopathica Internationalis and European Congress for Homeopathy, which took some initiative for uniting homeopathic doctors. And I think maybe it would be good if your forum joined the activity of Liga Medicorum Homeopathica Internationalis. For example, recently you had president of Liga, Dr. Alec Parek. He has very, very honorable family. His father is homeopathic doctor. His son is wonderful homeopathic doctor already. So maybe join efforts with Liga Medicorum Homeopathica Internationalis and not make separate stream of actions. Because if we are together, we must be together. Otherwise, I know that now, during especially COVID time, a lot of doctors have initiative for seminars, and this is even free seminars for treatment of COVID and so on, so on. But maybe with Liga, it would be more simple, not too much additional motions and strengths.
Okay.
What do you think?
But unfortunately, Liga is not doing anything during COVID time. That is a best opportunity for homeopathic doctors to come out and proclaim the effectiveness and wonders possible through homeopathy. Nobody is doing anything in this time. Liga is supposed
as far as I know, Sorry, as far as I know, Dr. Alok Park was invited by Prime Minister of India for conversation among other medical doctors. He was the only homeopathic doctor. Dr. Raj Manchanda also is rather active. He made a conference on COVID, and I see here Jos, doctor who was in our country, Jos Isaac. Hello, Jos. And he also gave us some information, sent some information. I do not think that Liga did not do. And you know, on the website of World Health Organization, there are information from Liga, given from Liga, about homeopathic patients with COVID, observation of symptoms, and so on, so on, so on. So I do not think that Liga did nothing. Probably we are not informed even about activity of each other. There is problem. So if your forum is going to become new big world organization, it will be kind of competition, maybe not necessary to do this.
Of course, there
you
is
know,
no need
we need to have teachers, and our students need to have teachers. For if your forum will organize, you see here doctors also exchange their experience. It was very good, Dr. Gieta and so on. Wonderful experience, deep experience. So, and we exchange doctor with doctor, but we need to exchange this experience with our students. It would be perfect. It would give this knowledge to students. So if you organize teaching course in the frames of your forum for those who want to know homeopathy, it would be very good. And you know, now I translate one book into our language, into two languages, in Latvian and Russian. This book has name Homeopathy as Strategy of Survival. It's written by German homeopaths, and book contain all information about COVID, about all this. I don't wish to say about series of plots and so on, but there are very valuable information. A little bit too much because he's not medical doctor, he's just homeopath and follows homeopath. He interviewed a lot of medical doctors, homeopathic doctors, Maximo Mangilavori and others, yes, some doctors from India too. And maybe we need to spread such information because, you know, for example, I cannot participate in such forums very frequently. I'm a terribly busy person. Okay. I prepare seminar by seminar, and it's very interesting. It's very interesting, this exchange, but maybe we need to collect people who want to study homeopathy, and we can help them with online teaching course. Maybe not all over the world, but maybe local people around you, closer to you. You see, what I'm doing now, I do maximum. I do maximum. I cannot do anymore because I'm preparing each week next seminars for my medical doctors who study homeopathy with me. It's not very big number. We are not permitted to take big number.
International Forum for Promoting Homeopathy, it's not only for the doctors, it's students, and mainly it's for the homeopathic lovers. The initiative of the International Forum for Promoting Homeopathy is mainly for the lovers of homeopathy. So it's with the engineers, it's with businessmen. So the collective of, there are a good number of teams with IFPH. So
it's just very good. It's just very good that you're doing this, and people go around you, follow you.
There are good marketing people are with us. So that's why there's a very good backend team for IFPH. So that's why we are uninterruptedly, daily Zoom session is happening, and we are looking to expand. We are looking to expand, and it's same like as Dr. Shaji said, this is a very good opportunity, like Lika and some of the any homeopathic, the international community, this is a very good opportunity. But they
Okay, but sorry, what about lovers of homeopathy? Are they medical doctors or just people who want to study homeopathy? It's like anyone who are interested to know.
No, actually,
about.
homeopathy, this forum is formed mainly for the purpose of promoting homeopathy. And the promotion of homeopathy should be done by homeopathy doctors, homeopathy students, and also mainly by homeopathy supporters and lovers who are patients who experience the effectiveness of homeopathy. It is their time to proclaim their experiences that they received when some people are telling homeopathy is worthless, useless, it is unscientific, many names are they are calling. So it is the time for the homeopathic patients to come out and demand their right to have homeopathy.
But you know, for this it would be very good if this patient would be organized in organization. In Europe, they have patient homeopathic associations. Yes. So if you do it from your side, it would be perfectly, because really then homeopathic patient organization can become a political force to protect homeopathy.
So this is a forum formed for that purpose of uniting all people connected to homeopathy to form a united front to demand the rights that is oppressed and suppressed today internationally, especially by World Health Organization and other healthcare authorities in the world who never consider the way the health should be looked holistically into, but always one-sided decisions they are taking, totally ignoring the real possibilities and the real health essentials. So this is the time to make a paradigm shift from a business industry, health industry perspective to a humanitarian health service perspective. And that is not happening today. And the homeopathic organizations of the world, leading organizations of the world at the time of pandemic, unfortunately are remaining so silent. And we are very unhappy about it, especially homeopaths from India. We are taking so much painful and passionate about this wonderful medicine, and the potentials and possibilities are very high. But unfortunately, the possibilities are not being proposed to the leaders who take decisions, and we are sidelines. So this is the time for us to do something. And this is not to remain silent. This is to proclaim what homeopathy can do to humanity. When the entire economy of the world is down, so many people are dying, and the curative management and the treatment management is solely given to a system of medicine where they themselves declared there is no treatment with them. And the possibilities lies with homeopathy, which is totally ignored and sidelines. So these are very irrational things happening in the world, and that should be protested, and that should be brought to the attention and awareness of the people at large, including the political leaders and healthcare authorities. So International Forum for Promoting Homeopathy is a collective organization of all people who understand and support the effectiveness of homeopathy to come forward and demand the rights that homeopathy deserves in serving humanity.
Thank you, Doctor. Thank you, Dr. Shaji. Okay, I'm moving to, ma'am, you want to add any more thing? Dr.
Yes, one second. I print in the chat one thing. I completely agree. We very much expected that India will be leader in the struggle with COVID, and we did not hear too much. But from time to time we saw. But to continue this conversation, I would like to invite you to our Congress next year. The name of Congress is The World in Homeopathic Perspective. Website is homeopathyworld.org. I do not know why it's not going to you. How can I send message to everybody?
You can put it in the chat box.
Yes, I did it, but talk.
Yes.
No, I cannot succeed. I cannot succeed.
Okay, you just WhatsApp me, doctor. I will share with others.
All right.
So
because of the time limit, I'm just moving forward.
Yes, okay.
Dr. Geeta, ma'am, you can conclude your point today. Dr. Geeta?
Yes, yes.
Yes, ma'am. You can conclude your point today.
See, my conclusion is that we have to work together, all of us. It is in the basic level, all of us has to work together. And regarding the pandemic and our COVID pandemic, we had made requests many a times to the government directly as well as through the secretary, through all people. We had directly to the minister also we had appeal. That is, but the minister also, she said she's not willing to give us an order to practice, that is to give homeopathy to COVID patients. So that was the effect. So at this juncture, all of us, we have to work together, hand in hand. We have to work together and we have to promote.
Right, absolutely right, ma'am. Expecting good session tomorrow. Thank you, doctor. Thank you, Dr. Geeta. Dr. Caesar Group, you want to add anything more?
Yes, I like to add one more.
Please,
Dr. Mariana asked that we must have to teach the local level. I have a 150 people that I gave last 45 days a free course regarding that the general people to know what is homeopathy and etc. with free, not charge even anything. I was giving and about 150 people. Now next one more batch I am going to start. After that, I am going to start in English also. But who are interested, they can join. I don't want any fees or anything.
Thank you, doctor. Thank you, doctor. Dr. Amir
So
Malik?
that I want to inform because she suggested
Yeah,
that we are doing it here. It is in local language, Malayalam. Now it is, I am going to start it in English also. Which they are interested, they can join.
Great, 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 Sridhar Group, Dr. Sridhar Group, sir. Dr. Amir Malik?
Yes, sir. Yes, sir. Sir, I have to question Dr. Marina. What the medicine she is giving in COVID? And number two, my request to all doctors, to all our doctors, that please, this is the time to protest against the vaccination process. It is as dangerous as the MMR vaccine. Dr. Marina and the other doctors, they know it was used. It is using still in UK and USA. My question is to Dr. Marina to protest us regarding this matter, the vaccination. What effort has been done at their country, or what is their role or behavior regarding the vaccination process? And every doctor must share the vaccination issues, as I am sharing that I protest this process. I prepared a petition. I'm sending in the court of my country that we don't go for the vaccination. So it's like that. Please, all the doctors state this kind of details on this platform and unite this power to fight against that third power who is forcing us to go for the vaccination. Because before we go for the vaccination, we have the very safest type of system of medicine, which is known as homeopathic, and which is 100% safe. So why the world on this fertile time, they are not promoting and pushing towards the homeopathic medicines? Either they are pushing and screwing towards vaccination. So please, if this power, these forces are united on this grand platform, so our mission is that we should protest against these issues. So we should unite together all our skills, all our experiences to share on this platform, and we should unite on Ifph. So this is my grand request, and special thanks to Dr. Geeta for their prescriptions. It's excellent. And as special thanks to our all creators, lovers, and king of Ifph who made this historical effort forever. So God bless you all, and my kind regards to all our doctors and lovers of homeopathy.
Thank you, Doctor. Dr. Marina, you want to add anything? Any answer?
Yes, I can add everything, anything if you like. We are struggling with vaccination, of course. All my patients not vaccinated. And what I noticed, interesting thing, that after homeopathic treatment of COVID, antibodies increase dramatically. And even after 1 year, first my patient was in March 2020. After 1 year, he increased number of antibodies, anti-COVID. And I had one interesting case when patient was not got constitutional remedy from chronic problem, and then she got COVID. And I did not give any remedy. I said, observe. In few days, she called me and said, I wake up and I understood that I'm healthy. So constitutional remedy provide immunity and human body can cope with the problem. And all these patients has enough antibodies, but we cannot do anything against governmental pressure. We inform our population. I sent them information because there are some information which exist, our laws accepted on European level, that we have a right to escape this vaccination because we do not let enter our body what we do not wish should was entered. Yes, and also there are some things when some wise people, some wise doctor advise to our patients how to escape vaccination. So those who want to vaccinate us need to provide us with all documentation, with all proving that vaccination is safe, with guarantees of safety, with guarantee that they will pay if patient will be damaged. Because we have cases when patient died after vaccination, information was spread, and then on the radio, governmental mass media reported that it's lie. He did not die of vaccination. So they hide information. We cannot make now open struggle with them. Now there's really survival process.
Yes, absolutely right, ma'am. So that's why Dr. Amir said, Dr. Shaji said, our voice should be louder and we should be united at the most. That's it. Yes, anyway,
yes. Meantime, I succeeded. I sent information about our Congress, the world in homeopathic perspective. It was very brave. It was organized before COVID, so it was absolutely true. We will talk about life in peace with viruses in bacteria, which is absolutely relevant to modern situation. So you're very kindly welcome to our Congress next year.
Thank you, Doctor. Thank you,
One question more, Dr. Marina. I'm sorry to interrupt. I'm really sorry. The main thing is that we know scientifically why they are making us fool. The all government of the all countries of the world, why they are making us fool. We know our immunity body have this ability to create antibody against any virus or bacteria or protozoan which is harmful to us. So why the doctors are not coming in the front of the media and indicating these points that we don't need to make scientifically foolish that COVID antibodies are not creating in our bodies. So you have to go for the vaccination. If that virus is natural, definitely our immune system will create the antibodies. But that virus is not natural. This is a lab work. Why the doctors are not standing? I want to stand. I want to.
Dr. Amir, I'll do one thing. I just want to wind up officially today's session, and we can have after that we can have a 15 minutes session more. Okay. So,
okay. One last only. Dr. Minna, tell me the medicine of COVID you have given. You uses more in your practice.
You ask me or somebody else? Do you ask me?
Yeah, asking you.
Okay. It was not one remedy, of course. It was Bryonia alba. It was Arsenicum album. It was Eusticat hatoda, very good remedy when we had very clear symptoms in early stage. Yes, Gelzemium, a lot of remedies. It's a lot of remedies was. Even camphora was, and if it was a case of complication, I had one patient who had she had bronchial asthma chronic and allergic reaction. So this was the most complicated case, but without
thank you,
hospitalization, we coped.
Thank you, Doctor.
Thank you, Honorable Doctor. Thanks.
Dr. Amir, I would like to call Dr. Jose Isaac. He's the teacher of Dr. Marina and a lot of people. So, Dr. Jose, you can wind up the session today and can say a word of thanks. Again, you can talk to your subject also. Please, Dr. Jose.
Thank you for giving me this opportunity. Anyway, I would like to add about Latvia. Latvia is one of the countries where homeopathy is having a very good association, Latvian Homeopathic Association, and Dr. Marina is the vice president of that. And Latvia, one more thing I have noticed is they have a homeopathic pharmacy, which was started in 1838.
1833.
1833, yes. I was there at that time. So it was during the time of Hahnemann, isn't
Yes.
it? Yeah.
Yes, it was
So it is
opened by
still there,
German
and they are
homeopathic
making,
doctors. First German
and
homeopathic doctors opened it.
yeah, they are
And
making
a
handmade
Russian
potencies.
Tsar gave permission because it was part of Russia at that time.
Okay. So you have rightly pointed out the things, and another thing, important thing is in Europe, people are coming to homeopathy not because to get a job or anything, but mostly allopathic doctors who are frustrated with the allopathic system of medicine and who is passionately associated with homeopathy because of the reading the philosophy of homeopathy and everything. They come to homeopathy. So that's very important. That's a good thing in Europe. And regarding Dr. Maria Salcedo from Bolivia, she has rightly pointed out that homeopathic education in that country should be improved. Then only homeopathy can come up in a big way. And the another speaker, Dr. Geeta Jose, my good friend, classmate, and colleague, she has pointed out two things which is very, very important. That's because the lack of single remedy, minimum dose, and also the management of emergency situations. Because many patients don't want to go to allopathy for anything. They wanted to remain with homeopathy. But because homeopaths sometimes fail in managing the emergency situations, they have to go to allopathic hospital. So these are very, very important points because it's okay. We all know that she is there, and around 80% of the homeopathic doctors themselves are not following these principles. So such things are there. So it is it is an unpleasant truth in a way, what she has said. Anyway, thank you for the excellent presentation on the 295th day of the International Forum for Promotion of Homeopathy. One more thing I would like to say is we are not an alternative for Liga. Dr. Shaji, myself, Dr. Ismail Said sir, all are members of Liga. Liga is exclusively a homeopathic doctors association, and IFPH is a promoters association who are benefited from homeopathy. So once more, I thank all the participants, our panelists, and all the backend group, everybody who has participated in this wonderful session. Already it is late. Thank you once again. Bye.